Type 1 diabetes mellitus is a chronic medical condition that occurs when the pancreas, an organ in the abdomen, produces very little or no insulin. Insulin is a hormone that helps the body to use glucose for energy. Glucose is a sugar that comes, in large part, from foods we eat. Insulin allows glucose to enter cells in the body, where it can be used for energy or stored for later use. It has other important actions as well. Without insulin, blood glucose levels become too high, and over time, this will harm the body. Type 1 diabetes requires regular blood sugar monitoring and treatment with insulin. Treatment, lifestyle adjustments, and self-care can manage blood sugar levels and minimize the risk of disease-related complications. Type 1 diabetes often begins in childhood or young adulthood, but it can develop at any age. Worldwide, it is estimated that 82% of people living with type 1 diabetes are aged 20 years or older. In the United States, Canada, and Europe, type 1 diabetes accounts for 5 to 10% of all people living with diabetes. Being diagnosed with type 1 diabetes can be a frightening and overwhelming experience, and it is common to have questions about why it developed, what it means for long-term health, and how it will affect everyday life. For most people, the first few months after being diagnosed are filled with emotions. You and your family can use this time to learn as much as possible so that diabetes-related care, continuous glucose monitoring, medical appointments, daily insulin, nutrition, foot care, becomes a part of your routine. In addition, you should talk with members of your diabetes healthcare team about resources that are available for medical as well as psychological support. This might include group classes, meetings with a nutritionist, social worker, nurse educator, or psychologist. Despite the risks associated with type 1 diabetes, most people can lead active lives and continue to enjoy the foods and activities they enjoyed before being diagnosed with diabetes. Diabetes does not mean an end to special occasion foods like birthday cake. With a little advanced planning, most people with diabetes can enjoy exercise in almost any form. Type 1 diabetes usually develops when the immune system destroys the insulin-producing cells, called the beta cells, in the pancreas. This is called an autoimmune response. The cause of this abnormal immune response is being studied. This process occurs over many months or years. High blood sugar and its associated symptoms, such as frequent urination, thirst, do not usually occur until more than 90% of the cells that make insulin have been destroyed. Type 1 diabetes can develop in people with a family history of type 1 diabetes, but it also develops in people with no family history of diabetes. In either case, people who develop diabetes have one or more genes that make them susceptible to the disease. Environmental factors and exposure to certain viruses might trigger the autoimmune response. Close relatives like children and siblings of a person with type 1 diabetes have an increased risk of developing type 1 diabetes compared with a person with no family history. Genetic testing can help to determine if a family member is at risk of developing diabetes. However, these tests are currently only available to people who participate in a clinical research trial. Family members at greatest risk for developing type 1 diabetes have high levels of substances called pancreatic autoantibodies circulating in their blood, which can indicate that the body has started to destroy its own insulin-producing cells. These blood tests are available. Teplizumab is a medication that is given by infusion through an IV and can delay the onset of type 1 diabetes. It is available for people ages 8 years and older who do not yet have diabetes, but do have abnormal blood sugars and elevated levels of 2 or more pancreatic autoantibodies. Symptoms. Most people with type 1 diabetes have symptoms of high blood sugar levels at the time of diagnosis. These include excessive thirst, feeling tired, needing to urinate frequently, blurred vision, feeling hungry, unintentional weight loss, and frequent yeast infections or urinary tract infections. Slowly healing wounds. Less commonly, people with type 1 diabetes have symptoms of a serious problem called diabetic ketoacidosis, in short DKA. People with DKA have symptoms of high blood sugar as mentioned previously, as well as nausea and vomiting, belly pain, breathing rapidly, feeling sluggish, having trouble paying attention, and sometimes coma. DKA is a medical emergency and must be treated promptly. Blood tests. Simple, inexpensive blood tests are used to diagnose diabetes. Having a higher than normal blood sugar, as well as the symptoms described, usually means that you have diabetes. If you develop diabetes before adulthood, it is usually easy for a healthcare provider to tell if you have type 1 or type 2 diabetes. In this situation, your healthcare team will treat you as if you have type 1 while awaiting the results of further blood tests. However, if you develop diabetes as an adult, there are many situations where it may not be clear if you have type 1 or 2 diabetes. In this situation, additional blood testing may be done. Treatment of diabetes requires a team approach, including you and your family and healthcare providers such as doctor, nurse, diabetes educator, dietitian, and sometimes other clinicians such as mental health professionals, podiatrist, etc. Keeping your blood sugar near normal can reduce your risk of long-term complications, such as eye and kidney diseases and problems with the nerves in different parts of your body. This means that you will need to check your blood sugar several times per day or use a continuous glucose monitoring device, give insulin shots or use an insulin pump, monitor what you eat, and see your diabetes care team on a regular basis. You should also have your eyes checked by an eye care professional and practice good foot care. Your diabetes care provider will check your kidney function regularly. People with type 1 diabetes are at increased risk of cardiovascular disease, which can cause heart attack, chest pain, stroke, and even death. However, you can substantially lower your risk of cardiovascular disease by not smoking, managing high blood pressure and high cholesterol with diet, exercise, and medications, keeping your glycated hemoglobin, A1C, at 7% or lower, taking a low-dose aspirin every day for adults with cardiovascular disease and sometimes those who are at increased risk of cardiovascular disease. If you like this video, leave a thumbs up, share, and don't forget to subscribe and turn on that bell icon to get notified for new videos like this.